Are you turning 65 in April? Well, listen up. I have great news. There are things you must do regarding Medicare and Social Security, and I'm going to walk you through that. There's a whole list of things depending on your situation that you need to know about regarding Medicare and Social Security. So that is what we're going to walk through. And then watch till the end of this video because I'm also going to show you how you can save $1,100 a year on your Medicare cost. Hello, my name is Kwame Kwade. I am an entrepreneur and personal finance expert. For 15 years, I have been helping seniors get the retirement benefits they deserve. We started with websites on Social Security, Medicare, food stamps, Medicaid, and now we have added video content. And I'm also an adjunct professor and I teach finance at one of the most prestigious universities in the United States. If you're new here, hit the like button, hit the subscribe button because we appreciate your support. And as always, I want to know where you're watching this broadcast from. Go in the comment section and let me know your city and your state. But let's dive in. So, if you're turning 65, there's a whole host of things that you need to do, especially regarding Medicare. And if you are on Social Security or you are not on Social Security, there are additional things that you need to consider. And that is what I want to talk to you about. And there's a lot to cover. So, stay with me. Let's talk about turning 65 and what you need to do about Medicare. So there is something called the initial enrollment period. You can enroll in Medicare starting 3 months before your 65th birthday and then up to 3 months after, giving you a total of 7 months to sign up. Missing this window may result in late enrollment penalties that increase costs permanently. Now, if you're already receiving Social Security benefits, you will automatically be enrolled in Medicare Part A and Part B when you turn 65. Your Part B premiums will also be deducted from your Social Security benefits. So you're going to see a new bill being deducted from your Social Security check once you hit 65 if you're already collecting Social Security benefits. Now, Medicare Part A is free. Most people qualify for a premium-free Part A if they or their spouse paid Medicare taxes for at least 10 years. However, Medicare Part B requires monthly premium, which starts in 2025 at $174.70. That's where it starts. Now, you need to plan ahead. Enroll early to avoid coverage gaps and ensure your benefits start on time, especially if you're not receiving Social Security benefits. So, what does that look for you if you are turning 65 in April? Well, here's what the calendar looks like. So, your initial enrollment period starts in January of this year. So, you have January, February, and March. If you have missed that window, you still have April to sign up. But then if you don't sign up in April, you still have 3 more months, May, June, and July. So you have a total of 7 months, 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after to sign up. Now, what if you're already receiving Social Security benefits? If you're already receiving Social Security before age 65, Medicare Part A and Part B enrollment is automatic. Coverage begins the first day of your birthday month. So April. Your monthly Part B premium will be deducted, as I mentioned, from your Social Security check. It makes things very easy. And you must actively enroll in additional plans. So if you need additional services, because Medicare Part A, Part B don't cover drug costs, vision, dental, then you must enroll in those additional services, including Part D, which is prescription drugs, Medicare, which is supplemental insurance, or Medicare Advantage plans. And I'll talk about how you can save money and also how you can avoid being part of the 90% of seniors that are on the wrong Medicare plan because there are 24,000 plans out there. So if you want to learn about all of this, stay till the end of this video. I have great news on that. Now, if you don't want Part B due to other coverage that you currently have, return the Medicare card sent to you before coverage begins to avoid paying monthly premiums that you should not be paying. Now, if you're not receiving Social Security yet, then that's another layer of complexity. If you're not receiving Social Security benefits, you must actively enroll in Medicare during your initial enrollment period. This ensures timely coverage and avoids the penalties. You can apply online or by calling Social Security at 1-800-772-1213. You have to call Social Security in order to enroll in Medicare. Since you are not receiving Social Security payments, you will need to pay your Part B premium. Remember, I said it was deducted from your Social Security check. Well, if you're not currently receiving Social Security because you're delaying claiming benefits, then you have to pay for the Part B premium on your own. And so you can do a bank draft, direct, debit to your bank. And it's important to consider the timing of all of this. Even if delaying Social Security benefits, enrolling in Medicare on time prevents costly penalties and ensures access to healthcare services when needed. Now, if you're working, that's another layer that you need to consider about. If your employer, your current employer where you're working has more than 20 employees, you can delay enrolling in Medicare Part B without penalties as long as you have group health insurance coverage. Now, you still have to sign up for Part A. Most people enroll in premium-free Part A at age 65 since it doesn't interfere with employer coverage unless you're contributing to an HSA account. And then there's what is called the special enrollment period. Once employment ends or employer coverage stops, you have an 8-month special enrollment period to sign up for Part A and Part B without penalties or gap in coverage. So then you have to plan ahead, confirm how your employer insurance coordinates with Medicare to avoid surprises when transitioning from work-based coverage to Medicare plans. Now, if you're planning to retire soon, let's talk about that. Enroll in both Medicare Part A and Part B during the initial enrollment period or your special enrollment period to ensure healthcare coverage starts immediately after retirement. Many retiree health plans require enrollment in Part A and Part B for full coverage, so check with your employer's benefit manager before retiring. If retiring after age 65, enroll within 8 months of losing employer-based benefits to avoid the lifetime penalties for delayed enrollment in Part B or Part D. And then let's talk about COBRA. COBRA continuation coverage does not qualify as creditable insurance under Medicare rules. So sign up for Medicare even if COBRA temporarily after retirement, even if you're using COBRA temporarily after retirement. Now, if you're moving out of state, there is also things you have to consider because some of the Medicare plans are state-based. Original Medicare Part A and Part B provide nationwide coverage, so no changes are needed when moving out of state, unless you're switching providers who accept assignments differently. However, Medicare Advantage plans, those are state-specific or region-specific, so moving out of state triggers a special enrollment period, the 8-month period I'm talking about, allowing you to choose a new plan compatible with your location. And then Part D, standalone drug plans may require switching based on availability in your state. So using the special enrollment plan triggered by your move to avoid penalties or gap in coverage. Now, notify Social Security promptly about your move by updating your address online or calling the 800 number to ensure accurate billing and communication regarding your benefits. Now, when should you start Social Security benefits? Well, you have several options. Age 62 is the earliest. You can start receiving Social Security benefit as early as age 62, but remember, your monthly benefits will be reduced by 30% compared to if you waited till your full retirement age. Now, full retirement age is 67 for those born in 1960 or after. So waiting until that time means that you get 100% of the benefits you have earned. Now, if you delay things till age 70, you get 8% more each year between your full retirement age and age 70. So that gives you more money. And then deciding when to start depends on your personal factors, your health status, your financial needs, spousal consideration, all that factors into when to claim Social Security. So contact a professional to help you work through all of these. Now, if you're working while receiving Social Security, there's more things you have to think about. If you collect Social Security benefits before your full retirement age and continue working, there is something called the earnings limit that you must pay attention to. In 2025, that limit is $23,400. If you go above it, there are penalties. For every $2 you earn above that limit, you lose $1 of your Social Security benefits. However, these withheld amounts are later factored back into your benefits and calculated after your full retirement age. Now, once you reach full retirement, there is no limit. You can work as much as you want, and there's no penalties for Social Security. Now, how does spousal benefit factor into all of this? Even if you don't work enough to qualify for Social Security, you may be eligible for spousal benefit based on your spouse's earnings record. This is often up to 50% of the worker's primary insurance amount. Should you file or should you suspend longer? The file and suspend strategy, allowing one spouse to delay benefits while the other claims benefits, is no longer available. Congress closed that loop. Instead, both partners need to be coordinating their benefits carefully. If your spouse passes away, survivor benefits can be claimed as early as age 60, providing critical income replacement and financial stability during grief and adjustment periods following a loss. And then consider everything. Understand your combined retirement portfolio before deciding to collect Social Security or delay Social Security collection. This informs optimized joint decisions for household maximization, and consult a professional, tax, legal, financial person who can help you put everything together and make an informed decision about when to claim Social Security benefits. Now, if you're on SSDI and you're transitioning to Social Security, that's another layer of complexity. When you reach full retirement age, your Social Security disability insurance benefits automatically convert to Social Security retirement benefit. There is no need to reapply or take any action. The amount you receive monthly typically remains the same, ensuring a seamless continuation of your benefits. However, future cost of living adjustment may affect your payment amount. And then if you've been receiving SSDI for 24 months, you are automatically enrolled in Medicare Part A and Part B. This typically happens before age 65, providing continuous coverage. And because if you're working, because you've been receiving SSDI, you've already met the work credit requirement for Social Security. So there is nothing you have to do, because to get SSDI, you must have met the requirements to get Social Security benefits. If you're on SSI and turning 65, what should you consider? Supplemental Security Income is a need-based program. Unlike Social Security retirement benefits, eligibility continues as long as you meet income and resource limits. SSI does not automatically convert to Social Security retirement benefits at age 65. Your eligibility for SSI continues to be determined by your financial situation. You may be eligible for both Social Security and SSI depending on your situation. So if you apply for Social Security, see if you qualify for a higher amount. And then remember that SSI has strict resource limit, $2,000 for individual, $3,000 for couple. You cannot have more than this in your bank account, or you may jeopardize your benefits. It may be cut, or you may lose the benefits altogether. Now, if you're living abroad, then there's a whole host of things you have to think about too. Medicare generally doesn't cover healthcare services you receive outside the United States. With limited exception, this means you typically can't use your Medicare if you're living abroad. If you plan to return to the United States permanently in the future, you may want to enroll in Medicare Part A if you're eligible for premium-free benefits to avoid potential delays upon your return. This decision depends on future plans and healthcare needs. Now, regarding Part B, enrolling in Part B requires paying monthly premiums. So if you're not going to use it because it doesn't get covered where you are, then it doesn't make sense. Delaying Part B enrollment, however, can lead to permanent penalties if you enroll later. Consider local healthcare. Research healthcare options in your country of residence and purchase local or international coverage so you have healthcare coverage while you live abroad. What about Social Security? You can usually receive Social Security retirement benefits while living abroad if you're a US citizen, but there are some country specific restrictions. Check the Social Security Administration's website for details. Social Security benefits can be directly deposited into bank accounts in a foreign country. Your tax benefits, your Social Security benefits may be subject to US taxes regardless of where you live. So you need to understand that, consult a professional that can walk you through these tax implications and help you make an informed decision. And then you need to stay in touch with rules that are happening with Social Security, changes that are happening that can affect your benefits. Keep the Social Security informed of your current address and changes to your banking information to ensure uninterrupted benefits. You can manage setting tasks online through the Social Security website or via phone. Now, if you don't have access to a computer or you're not digitally savvy, seniors lacking internet access or are not comfortable with technology face significant challenges when shifting to online. You can go to organizations like the AARP or senior centers in your local area to get help to be able to get online and get some of these services activated. And if you're cognitively impaired, there is also help for you, and there's legal assistance that you can tap into. Elder law attorney or disability advocates can help you navigate Social Security and Medicare if you need help with that. And then with all of this, there's so many things you need to consider. Seek professional guidance. There's tax implications, there's financial implications. So make sure that you are consulting experts, financial advisors, tax advisors, attorneys, CPAs, people that can look at the full picture of your situation and help you make an informed decision about when to claim Social Security, decisions about Medicare, tax implications about you working and collecting Social Security, etc., etc. Now, let's talk about how you can save money. If you're already on Medicare or you're turning 65, there's a whole lot of things you need to consider about Medicare that a lot of people do not know about and end up in situations that are not financially optimum for them. And in the news every day, there are Medicare news, changes that are happening that you need to be aware of, loopholes or major problems that can affect your benefits in states where coverage is changing. People are losing benefits. People are losing coverage. Doctors that they want in their network are no longer in their network, etc., etc. How do you sort through all of this? Well, the big problem is that there are 24,000 Medicare plans out there. And as a senior, you have to figure out which of those plans in your local area fits your budget, the coverage you need, and the drug and the doctor network you need to be a part of. That is why 90% of all seniors are in the wrong Medicare plan, because there's so much to consider and it can cost you money. The average senior couple spends $300,000 on Medicare during retirement, and it can affect your health, access to the right services when you need it the most. So we've partnered with a Medicare advisory company that is top tier that can help you sort through all of this, and the service is free to you. And they are Chapter Medicare. Here's why. There are many reasons why I like Chapter, but they make Medicare simple. They help you understand, choose, and use your Medicare. And here is one thing that drew me to Chapter. One of their co-founders had a personal experience with Medicare through his parents, which was part of the reason why he decided to launch this company. And here it is. One of the co-founders of Chapter had watched his parents struggle to navigate the process of choosing a Medicare plan and wound up paying premiums that were hundreds of dollars a month more than they ought to have been. He realized what a terrible experience the whole process was and decided to do something about it. And then another co-founder, who is an attorney, also is an expert on Medicare. He wrote a book, one of the leading books on Medicare about it. And it's called The 3 Medicare Decisions to Protect Your Health and Your Family. These guys are experts. They understand the system. And there are many, many reasons why we are partnering with them. One of the reasons is that, remember, I told you there are over 24,000 Medicare plans. Chapter is the only organization with access to all of them. so they can see everything in your local area and recommend the best plan for you. But here is another factor: their licensed agents do not work for commission. So they are not there to sell you the most expensive plan in order to make the best commission. They are there to help you figure out the best plan for you. And when I say they, these are real people. They are licensed agents. These are the people you're going to be talking to. This is directly from their website. And so you're working with professionals who can help you pick the best plan for your needs. And so Chapter will show you every Medicare option, including detailed information about which doctors, specialists, prescription drugs, and hospitals are covered, and what copay costs and how the plans that they're showing you compare to traditional Medicare, so they can make an informed decision. So call them at the number 539-205-2147 or go to askchapter.org/insider, and they'll take you to a form that you can fill out for them to be able to help you. And the best part, they can save you on average $1,100 a year. So if you want to avoid being part of the 90% of seniors in the wrong Medicare plan, call Chapter now or go to the description in this video. There will be a link to the website for you to fill out a quick form, and they'll reach out to you. There may be a short window for you to do this if you're turning 65 or you're already on Medicare and you want to switch to a better plan because you're drowning in payments. Chapter is the place to go. They're highly rated by the Better Business Bureau, A+ rating, lots of 5-star reviews online. And did I mention they can save you $1,100 on average? So call Chapter now. And lastly, before I let you go, if you want to stay on top of what's happening with Medicare, Medicaid, food stamps, Social Security, and personal finance issues in and out of Congress that affect seniors and their retirement benefit, subscribe to our newsletter. Go to benefitsinsider.co/subscribe and just get daily updates that are going to help you stay informed and don't miss out on the retirement benefits that you have earned and deserve. Go to the description, or you can even go to our YouTube channel. At the top of our channel, there is a link for you to be able to subscribe to our newsletter. So do so now to stay on top of everything and be the first to know when breaking news happens that can affect your benefits. So until the next video, thank you for watching. If you have any questions, let me know in the comments.